Hello, I'm Emilia from Onelife Training. We are just looking today at a few questions that come up regularly on courses or from members of the public or for people who have done a course and they go, oh, I can't quite remember what we did about slings. So we're talking about upper body arm injury, could be upper arm or lower arm, and how to put the sling on, why we're using it, and what they're for fundamentally. So I'm just going to show you two slings here. This one here, the non-woven sling, they both come in similar sort of packages. This non-woven one, I don't think has as many uses as this calico one. So for example, mopping blood, cold compresses, things like that, because these have multiple uses. So if you can get the calico ones, they are a little bit better. However, you'll probably find the majority of the ones in your kits are non-woven. They both will do the job of slinging. When they come out, they look a little bit like this, a big triangle. And let's look at a way of kind of making this make more sense. First off, though, why are we putting a sling on? So I'm going to use Charlene here. She's going to come and be my volunteer or victim. So why do I need to put a sling on? If Charlene has come to me with an arm that is injured, there may be a couple of reasons why I want to put a sling on. It might be that Charlene, I say, take a seat, Charlene. Sit down there, you hold your arm, support your arm, that's it. And Charlene's perfectly happy here. And I might want to get a jumper or something and put it underneath to support her. And I don't actually have to use this at all. However, if Charlene is in lots of pain or moving around, then her injury might get worse. So we need to immobilise the injury and to keep it still and secure to help it from reducing pain and also reducing more injury. The other thing is that Charlene might need to move somewhere. And if Charlene is holding her arm and then moving across and trips or anything like that, both arms are going to go down to support, and that's going to be extremely painful and also maybe promote further injury. So a sling would be really useful in those scenarios. We can apply a sling to someone sitting down or standing up. It doesn't really matter. Depends on how your casualty presents to you. What I would say is though that there are a couple of tricks to make this slightly easier. So first off, with the triangular bandage, your sling, it's a big arrow. The long part of the sling, the long part of the triangle, goes down the centre of the body. And then you have an arrow pointing to the area of injury. That's a thing to remember, okay? So Charlene's presented with her right arm injured here. So the long bit's going to go down the centre and the arrow is going to that side of the injury. What I like to do as well is put a knot in the corner of my triangle to create a little hammock for the elbow. I don't have to do that, but it's nice and useful. And I can make it tighter at the end.
But people say to use safety pins.
So, I never use a safety pin as a first aider. Noise out of that. I find that I'm more likely to cause an issue to the casualty than it be any use. However, safety pins are great if you get to the end and you need to tighten bits up. I'm not against them. I just don't think they're necessarily necessary. The other little tip I want to give you just before I show you more about how to apply a sling is when putting this on, that person is probably going to be in quite a lot of pain. To get as much room as possible, I can ask Charlene to move forwards a little bit, move her top body forward, which is going to open up this gap here to put the sling inside so that I'm not having to prod and move her too much. Communication with your casualty is also really important. I don't want to say, right, I'm in control now, and Charlene takes her supporting arm away and causes further injury.